Have you lost your teeth due to severe tooth decay, gum disease, trauma, or even failed root canal? If so, you may qualify for implant treatment. Dental implants are used to replace one or more missing teeth in your mouth. Implants are made of titanium or similar materials that are well suited to the human body. They are artificial replacements for teeth roots that support a restoration or a dental appliance. Besides its cosmetic advantage, replacing the missing teeth will restore your ability to properly chew and speak. In addition, the space caused by the missing teeth may allow the surrounding teeth to shift into that space. This shifting could cause a misalignment in your bite that can result in problems with your jaw joint. These shifted teeth are harder to clean, making them more susceptible to gum disease, decay, or even additional tooth loss. Before we start, it's important that you notify your dentist of your medical condition, such as whether you have any artificial joints, diabetes, or a history of heart and valve conditions. You should also inform your dentist of any medications you are currently or have previously taken, such as Redux or Fen-Phen, blood thinners, or importantly, medications that contain bisphosphonates, like Fosamax. It normally takes a few phases and several months for your dentist to complete the treatment. In the first phase, your dentist will place the implants in your jawbone. It requires 3 to 6 months for the bone to fuse to the implants. In the second phase, your dentist will place an extension or a post to extend the implants above the gum line. This process can also be performed during the first phase, depending on the technique chosen by your dentist. After your gums are healed, it is time for an impression to be made and a final restoration or appliance to be fabricated by the dental laboratory. In most cases, on your final visit, the restoration or the dental appliance is placed and adjusted to ensure proper fit and function. While every effort is made to place a successful and functioning implant, it sometimes fails. This is mainly due to lack of proper attachment between the implant and the jawbone during the bone fusing phase. Other problems such as breakage of the implants, breakage or loosening of its restoration or dental appliance, and infection of the surrounding gums are also rare possibilities. Finally, due to differences in the shapes of the jaws and the bone density, the back area of upper jaw may require an additional procedure such as a sinus lifting to increase the predictability and long-term success. Please keep in mind that the longevity of your implant and its restoration depends in large part on your oral hygiene, diet, and the health of the supporting bones and gums. Please ask your dentist for proper brushing and flossing techniques. If you have any additional questions, please consult your dentist.